Hi there, I'm Andrea Brognano. I'm a licensed mental health clinician specializing in anxiety, and here's a complete overview of what panic attacks are. In this video, we're going to cover the definition of a panic attack, review panic attack symptoms, understand what does a panic attack feel like, recognize a heart attack versus a panic attack, go over anxiety attack versus panic attack, and learn ways of how to cope. So, what is a panic attack? Panic attacks are sudden, intense feelings of terror that can occur at any time and without warning. In some cases, they happen at night while you're asleep, or they can happen randomly while you're doing a mundane task. Panic attack lengths do vary, but the typical episode is often between 5 to 20 minutes, with the anxiety typically peaking within 10 minutes. However, in some cases, symptoms persist for several hours. Here are some symptoms of panic attacks. And keep in mind that everyone experiences panic attacks very differently. Some have heart palpitations, difficulty breathing, chest tightness or pain, sweating, increased body temperature, dizziness, nausea, choking or smothering sensations, fears of losing control or going crazy, fears or thoughts of dying, intense paranoia, feeling weak or numb. So, what does a panic attack feel like? Many people describe their attacks as feelings like they're dying. A panic attack can feel like a serious physical health condition similar to that of a heart attack. Some people may call an ambulance or be admitted into the emergency room due to the severity of their symptoms. Now, you might be wondering if a panic attack can kill you. No, you can't die from a panic attack, though during one, it often feels like you can, especially if the symptoms of a panic attack overlap with the symptoms of a heart attack. In fact, feelings or fears of dying during a panic attack is a very common experience, and it's listed as one of the symptoms to diagnose a panic attack. But what if it feels like a heart attack? How am I able to know the difference? Heart attacks and panic attacks have many of the same symptoms, making it easy for patients to confuse the two. A heart attack is usually triggered by physical exertion, while a panic attack can happen at any time and is triggered often by anxiety. Also, heart attack symptoms like crushing chest pain and tingling arms continue to worsen over time, while with panic attacks, those usually subside about 10 minutes after. Having an existing heart condition places people at a higher risk for heart attacks and strokes, while having an existing mental illness, especially an anxiety disorder, increases the likelihood of panic attacks. Now, you might have heard people say they're having an anxiety attack or panic attack interchangeably. So here's the key differences. First, it's important to note panic attacks are well documented and researched mental health concerns. Panic attacks are listed in the American Psychiatric Association, APA, the text called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, which defines and validates the condition. On the other hand, anxiety attacks are only a phrase people use to express times of feeling very anxious. The term anxiety attack is found nowhere in the DSM, so it's not officially a recognized condition. Although some symptoms might overlap, there are key differences between anxiety attacks versus panic attacks, and here's how to spot them. Intensity. Panic attacks live up to their name. These attacks bring on a sudden rush of emotion and physical change, while anxiety may be more subtle and present with a slow build. The duration. Panic attacks are short and anxiety is long-lasting. The onset. Panic attack is as obvious beginning and end. A person could be feeling fine 1 minute and have a panic attack starting suddenly and then end shortly after with initial symptoms. Anxiety usually ebbs and flows more gradually throughout and has a start and clean finish. Triggers. The triggers of anxiety attacks tend to be less intense and less frightening than the triggers of panic attacks. For example, being confronted by a small dog could trigger anxiety, but having a pack of aggressive dogs running towards you could trigger a panic attack. Outward appearance. People experiencing an anxiety attack may be able to experience the symptoms without anyone noticing. The same may also be true of panic attacks. So what do you do during an anxiety or panic attack? Periods of high anxiety and panic attacks can be overwhelming and chaotic, so people may react emotionally rather than using rational judgment. Here are some strategies that can help during a panic attack or anxiety attack. Notice the early symptoms. Prevention is always best, but if you're already in the middle of an attack, try to identify and assess your experience. Ride out the rush. Ride out this initial rush by staying presently aware aware of your surroundings and in the moment. Attend to the people and things around you, and even use a grounding technique, something like the 5-4-3-2-1 method. Call it discomfort, not danger. Tell yourself that the chances are due to anxiety or panic, and you don't need to escalate the worry by thinking you're having a stroke or a heart attack. Retrain your thoughts. Tell yourself, I can do this. This is only anxiety. I'm going to be okay. I can use my skills. Seek positive ways to cope. Calling a friend, performing a relaxation technique, listening to a favorite song, listing the 50 states, or exercising. Whatever it is that works for you, just have your skills ready and know what those are. Avoid substances and negative behaviors. These are short-term fixes, and more problems can occur in the future. Treatment for anxiety and panic attacks. It's important to commit to long-term treatments for panic attacks, such as therapy, medication, and lifestyle changes to prevent the future problems. With a combination of professional treatments and at-home remedies, a person can find relief from their anxiety. The use of therapy. With its limited risks and high rewards, therapy for anxiety and panic attacks is a great first choice. One of the most successful and frequently recommended forms of therapy is cognitive behavioral therapy, or CBT. CBT helps teach the person a new way of thinking and is behaving to target symptoms of anxiety and panic disorder. Medication. People who do not get the desired relief from therapy alone might explore medication options for anxiety and panic disorder. For anxiety and related symptoms, there are two main options: benzodiazepines and antidepressants, which can be prescribed and monitored by a psychiatrist. Lifestyle changes. Lifestyle changes are often small, but their impact on anxiety and panic can be significant. These can be a diet change, adding physical activity, or getting more sleep. These adjustments are often free. Even if they do not improve anxiety, they can improve a person's overall mental and physical health. My final thoughts to add to this is panic attacks can be scary, challenging, and overall frustrating, but having insight into symptoms and access to solutions is the key to feeling better. Moreover, you can learn how to manage your anxiety symptoms with the help of a therapist. By practicing optimal stress management, you can reduce the likelihood of future attacks.